True or false? Obesity is caused by overeating. There are a lot of misconceptions when it comes to bariatric medicine and obesity, including what the true cause of obesity is. During this episode of Banner House Making the Rounds, two bariatric providers will describe the complexity of the disease while debunking some myths you might not know are false. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. I am your host, Caitlin. And with me today are two bariatric surgeons at Banner University Medicine, Obesity and Bariatric Surgery Center, Dr. Christine Lovato.
Hello, Caitlin.
Hi. And Dr. MacKenzie Landin.
Hi, Caitlin. Thanks for having me.
Thank you both for joining me today. Dr. Lovato, let's start with an overview. So obesity is a growing public health problem, not just in the United States, but globally. More than 300 million adults have obesity, and I got this number from the World Health Organization.
Yes, Caitlin, it's an existing problem that's been around since the 1940s, 1950s, but it's been growing in its scope among adults and children. Obesity in the United States currently, there's about 40% of the population that would meet the criteria for having obesity, which is above a certain body mass index. And the effect on cardiac disease, on stroke, on chronic conditions such as type 2 diabetes, and even cancers are significant. And these are worsening. Obesity has actually taken over as far as the number one cause of preventable disease. It surpassed smoking, which previously held that title. And the important thing to know about obesity, Caitlin, is that it's not about overeating all the time, right? It's not about exercising and eating less. That doesn't fix the problem. There are so many things that contribute to obesity that we have never addressed in treating the disease. And that includes things like food deserts and access to high quality foods, our entire food culture that revolves around ultra processed food products, sugar, artificial sweeteners, medications that we utilize to treat the common comorbid conditions related to obesity can contribute to it, as well as sleep hygiene, circadian rhythms, shift working. There are so many other things that really we have not even begun to tackle when it comes to this disease.
Dr. Lovato brings up a lot of good points, and I'd like to spend a little bit of time just discussing this further. You know, there's a stereotype out there that obesity is really due to a lack of willpower or making bad choices, and that's just simply not true. We've seen adoption studies performed where the environment has been controlled for, where they've been able to look at the relationships between adoptive and biological parents with children, and there's a correlation with a child's weight based upon their biological parents' weights. There is a genetic predisposition that can become reality despite people's best efforts. And having obesity is really a disease like any other and must be treated as such. I'd like to clarify the difference between being overweight or having a higher weight and having obesity. As clinicians, we use the distinctions between these two to help define the severity of disease. Patients who have a BMI of less than 35 are classified as having an overweight diagnosis. They would really benefit from medical management to minimize their risk of developing obesity, as well as reducing the risk of complications from obesity-related diseases like sleep apnea, diabetes, and arthritis. For patients whose BMI is greater than 35, they would carry a diagnosis of obesity. And depending on their comorbidities, they may qualify for surgery, which is the most effective means of long-term weight management and the greatest chance of reducing death or illness from obesity-related diseases.
And the important thing that Dr. Landin brings up as well, Caitlin, is, surgery works because it affects a person's hormonal physiology. And that really stems from one of the main causes of obesity, which is our genetics and our epigenetic makeup, things that we have absolutely no control over. 40 to 70% of somebody's risk for obesity actually comes from the genes and the epigenetic changes that they were born with. And we're learning every day that we can start to tailor the treatment of obesity a little bit better the more we learn about the disease. And eventually, at some point, we'll be able to specialize and tailor those treatments to each individual patient according to what their epigenetic or genetic risk is. And it's important that they get referred early to a specialist in obesity medicine, whether that be a bariatric surgeon or a bariatrician, someone who is board certified in obesity medicine, in order to really try to help that patient get a handle on the disease early before it gets to the point where their metabolic adaptation has made it much more difficult for them to treat that disease.
And in addition to referring people early, it's important that people are referred to be able to discuss what their options are. Between social media and TV and friends and family input, patients usually have an idea of which procedure they want before they even get to a surgeon. And sometimes that procedure is just not the right fit for them in terms of the benefits that they could have achieved with something else. And really, our job is to help maximize benefit while minimizing risk. And I would recommend patients to have those conversations with a obesity medicine or bariatric provider, before getting set on a specific procedure, so that we can help make sure that their journey goes in the right direction. And what's helpful is if people meet with their primary care provider and work on optimizing their own health conditions and obtaining age-appropriate screening prior to pursuing any sort of weight loss intervention.
That's all some really great information. And I want to expand a little bit because you talk about social media and there's always those kind of like quick fix methods or, we've heard of different tea you can drink that helps with being overweight. And I want to ask you, Dr. Landin, what are some other obesity remedies, I guess we'll call them, that you've heard of before in clinic?
Oh, there are quite a few, Caitlin, and some of them are born out of people's best intentions. Some of them are born out of science. What we use mostly, aside from dietary advice or psychological advice, are anti-obesity medications. They're prescriptions that are really targeted to help with appetite suppression and with changing people's metabolism. This is an area that patients are always very interested in. There are a variety of medications on the market and even more that are currently under development by pharmaceutical companies. And it's important that we talk with the patient about how those medications might help them and how sometimes the medication alone might not be enough to treat their level of disease. So it's really a complex conversation that needs to happen between a patient and a provider that really just can't take place, with clicking on Facebook or some other social media outlet.
Exactly, Dr. Landin. And, I had mentioned earlier, Caitlin, that, diet and exercise doesn't really seem to treat the disease as well as we thought it did. And as we're learning more about the physiology and the complexity of the disease, we have learned that it really is not caused by overeating. It's caused by a basic breakdown in the metabolic signals that control how hungry or full we feel, or how many calories we're burning versus how many we're storing as fat. It's important, of course, for patients to exercise and have good cardiovascular health and gain muscle strength, which will help improve any risk for weight gain later on down the road. And diet certainly is a key part of the treatment for all of our patients here at Banner University Medical Center. Changing somebody's food culture in their home is one of the hardest things we do as clinicians. And it's a very difficult thing in the setting of all of the ultra-processed food companies that have now become multi-billion-dollar companies. And they create these food products to ensure that we crave them. And the changes that are occurring in the metabolic signaling secondary to a lot of those ultra-processed food products has followed hand in hand with the epidemic of obesity. So that has to be one of the places that we start, getting people back to eating whole, real food that actually spoils, food that actually is made at home and prepared at home. And really helping people learn how to understand how to utilize food better and how to enjoy food.
Our clinic has a multidisciplinary approach in treating obesity, and that includes helping people understand their food culture. When somebody has heart disease, taking an aspirin alone doesn't always work to fix the problem. They have to take the aspirin, they have to increase their physical activity, and change their diet to decrease their risk of having a heart attack. And this is the same with obesity because obesity is a disease. Our group includes training for dietary modification, for anti-obesity medication, for psychological services. We have a variety of folks who are all here to help come up with a plan that will increase people's success after surgery. And our goal is really to identify realistic expectations for patients and help work as a team to ensure that it's a safe and positive experience for them.
That's great. And this is a really great topic, as we start the new year, because, diet and exercise and getting back on that healthy track is on a lot of people's minds. I mean, I know personally, one of the things I'm going to try is start incorporating less Doritos and more quinoa. Like you said, Dr. Lovato, things made at home. But obesity is such a complex disease, and we could have a whole series on this podcast just about the relationship and the nutrition involved and how it relates to the heart and other organs. But I want to thank you both for taking the time to share this information with our audience. And is there anything else that you'd like to add before we wrap up?
Thank you so much, Caitlin, for having us. And, I think one of the most important things we can really try to hammer home for other providers and for patients is, learn what your options are. Understand that there is a stigma against obesity, but those of us who treat it every day can really, really help you not only understand your disease, but find ways to treat it that in the past may not have worked for you, but there's new ways. And you don't have to commit to anything, but really sending your patient to see someone who specializes in obesity medicine, or as a patient requesting that you can see someone, really just kind of opens up the doors for your treatment of your disease. And that's the most important thing.
I totally agree. I think people should have an open mind, to not be afraid to ask questions, because a lot has changed and will continue to change. And we're only going to help treat this disease together if we all, work towards a common goal and be comfortable in that conversation.
Wonderful. Well, thank you, Dr. Landin. Thank you, Dr. Lovato.
Thank you, Caitlin.
Thank you so much.
Our listeners can learn more about bariatric medicine at Banner Health by visiting bannerhealth.com/services/bariatric-weight-loss-surgery.